Welcome back to the Video Atlas of Retinal Disorders. This is part 2 of combined retinal and pigment epithelial hamartomas. In this part, we will delve a bit deeper into this entity, and we'll talk about the vision, clinical appearances, the fluorescein angiogram, and OCT findings in this disorder. There have been several large studies, some from one center and other ones from a review of the literature, and they show that about 42% of patients will have a vision of 20/20 to 20/40 in this entity. That's not so bad, but 42% also have vision of less than 2200. Shields at the Wills Eye Institute did not find the vision to be quite as good. Their vision of 20/20 to 2150 was about 30%, and less than 2400 as high as 70%. This is a 46-year-old male who's referred to the eye clinic with a diagnosis of optic disc edema. His vision was recorded as 20/20. He demonstrates a typical appearance of a peripapillary combined retinal RPE hamartoma. The lesion is slightly elevated, charcoal gray, involving the retina and the pigment epithelium. The retinal vessels can be both straight and tortuous, and an epiretinal membrane is present, which is causing some macular striae. About half of the lesions are peripapillary or in the macula, and about half are in the periphery. Here's a red-free photograph of our patient, and you can see the lesion around the nerve, as well as the retinal striae and the epiretinal membrane. Here's the fluorescein angiogram of this patient. The left photograph is the mid-phase photograph, and if you look closely, you can see some dilated capillaries near the nerve and some leakage in the periphery. The late phase on the right shows staining of the dye in the late phases. Here is another patient of mine, and this is a 20-year-old who complained of decreased vision in the left eye after an auto accident that he had 3 years prior to my examination. He stated that he hit his head on the steering wheel, but he did not have any loss of consciousness. On the record, he'd been seen 4 years ago by someone else, but the patient could not remember if there's any comment made about the retinas at that particular visit. His vision was 20/20 in the right eye. The vision in the left eye was 20/25. On this exam, note the pigment and the membrane overlying the inferior portion of the nerve and extending inferiorly by about another disc diameter. About 3 to 5 o'clock off the nerve, you can see some whitening of the pigment epithelium, and you can also see the striae in the macula caused by his epiretinal membrane. Here's this patient's angiogram. You can see in the upper left photograph, that is the early phase. There's just some early laminar flow. And you can already see some of the dilated capillaries in the hamartoma. The mid-phase, these capillaries are much more prominent, and you can see the capillaries much better. In the late phase, there is leakage and staining of the glial tissue in this lesion. There are a number of studies in the literature now showing the OCT findings in this lesion. Usually they are very sharply demarcated, elevated, and they are hyperreflective in the inner portion of the retina. Shields et al. Looked at the time domain OCT of 11 patients. No patient showed a posterior vitreous detachment, and all but one had pre-retinal fibrosis. All the patients had retinal disorganization and photoreceptor attenuation. 5 patients had some inner retinal hyperreflectivity, and 6 were isoreflective. All the patients had outer retinal hyporeflectivity. Shadowing was present in only 5 patients.